What do I wish I knew before starting HCG? Quite a bit. One, I wish I'd started earlier, just because of like varicocele and atrophy that I could have staved off earlier in the process. I didn't start it until after I had a couple kids, so probably could have had a lot better energy during residency and after residency, and less atrophic changes and just straight up pain from the heat damage and the swelling. But what I really wish that I knew is how much is it going to affect my skin? A lot of people, no issues with HCG, but I just tend to get quite a bit of acne whenever I take it, regardless of the rest of my regimen. And I also tended to get quite a bit of skin breakouts when I was an adolescent as well. So perhaps this is correlated, and I do see when patients take it, if they've had breakouts in the past, it does tend to happen more with HCG. But it also can lead to swelling and pain of the gonads. So that's quite common. So you want to make sure you're not on too high of a dose. If you're on too low of a dose, it can also still decrease your LH and not give you as much benefit. So dose is super important for HCG, and that can be quite an individual by individual basis. In general, if you're not on HRT otherwise, so if you're on monotherapy, just HCG, then you want to look at something more like 500 IU 3 times a week. Whereas if it's an adjunct to TRT, it can be less than that.